Do you have pain on the outside of your knee? You might be dealing with a condition that is called IT band syndrome. I'm Dr. Clayton, and in this video we're going to be going over 2 simple exercises that are going to help solve your problem. But let's look at this diagram first. That way you have a really good understanding of what IT band syndrome actually is. If you look at the structure that is highlighted yellow, that is your IT band. It runs from the top of your hip, your iliac crest, down all the way and it attaches below your knee. There are several muscles that attach to it, like your glute max, your glute med, and your TFL. When those muscles get tight, they pull on your IT band, creating more friction down at the knee. You also have to take in consideration the nerve that innervates it as well, that comes from your lower back, that is called your lateral femoral cutaneous nerve. These exercises I'm going to be showing you are going to get not only those muscles to calm down, but also give that nerve some relief. The first exercise I'm going to show you is a great core exercise. The goal of it is to not only take pressure off the nerve that I showed on the diagram, but to also take some tension away from the muscles on the outside of the hip that are creating too much tension on the IT band. Whenever you think of tightness, I want you to start to think of a lack of stability. That those muscles are tight or there's tension there for a reason, and more than likely it's due to a lack of stability. So this exercise is going to create more stability for you. What you're going to do is you're going to lay on your back. Feet are going to be bent, chin down slightly, arms up towards the ceiling. The goal of the exercise is to not allow yourself to arch your lower back. You're going to pin your rib cage down and you're going to let the weight go overhead. You go back and forth 6 to 8 times. Very important, not letting your rib cage come up and allowing your lower back to arch. I also do not want you tucking your pelvis and rolling your pelvis or tucking it, trying to keep that back flat. That's actually going to cause more irritation on that nerve that comes out of the front of the hip. So lock that rib cage in, chin down, and let your arms go back and forth 6 to 8 times. You can use a dumbbell or a kettlebell. Again, the goal is to not allow your back to arch, creating more core stability, taking tension off that nerve and the muscles on the outside of your hip. This next exercise is to only be done on the side that is not painful. And the reason being is because we're going to take some workload away from the side that is painful. So you're going to make the opposite side do more work. For me, I'm going to pretend that my left leg is irritated. I have the IT band syndrome on my left side. I'm going to only do it on my right side. You're going to lay on your side. You're going to prop yourself up with your forearm. From here, you're going to put your feet behind you and you're going to lift. You can think of it as doing a modified side plank, making sure that you're in a straight line when you come all the way up. You're going to hold for 5 seconds and then you're going to sit back down. From here, you're going to go back up, hold for 5 seconds. If this is too easy for you, you can bring this top knee forward, making sure that you're not raising it up like this. You're going to actually make more tension in that TFL and it's going to cause irritation. So just bring it down nice and easy out in front of you and hold for 5 seconds, not allowing your hip to sag. Keep that hip away from the ground. Again, this is going to make that right side or the non-painful side do more work, giving the painful side some relief. When you're doing these exercises, make sure to do about 6 to 8 reps and 3 to 4 sets every time. If you have any questions, drop them down below. I'd love to help you. Until next time, keep moving and enjoy the rest of your day.